This is my blank rubric. Hi, how are you doing today?
Good, how are you?
Good, my name is Julia. I'm going to be your student nurse from Saginaw Valley today. First, can I just get your name and date of birth?
Emily Sheltraw, 3/31/2005.
Okay, and what year is it?
2025,
Okay, and then do you know where you are?
SVSU.
Perfect, Emily. So you're A&O times 3, so I feel confident moving forward. Today we're just going to be doing a head-to-toe assessment, which is just going to be an assessment of your bodily functions from your head down to your toe. Do you have any questions before we begin?
No.
Okay. First, I'm just going to ask some questions just to get a little bit of a health history on you. Just answer them to the best of your ability. This is a judgment-free zone. To begin, do you have any allergies?
No.
None to any medications or foods?
No.
Okay. And then do you have any current or existing medical conditions?
I'm anemic.
You're anemic?
Yeah.
How do you manage that?
I take an iron supplement.
And there's no complications with that?
No.
Do you deal with any dizziness at all?
No.
Okay, perfect. What about any past hospitalizations or surgeries?
I had my wisdom teeth removed about 4 years ago.
And did that heal okay?
Yeah.
Okay. What about any pertinent family history I should know about?
My mom's also anemic.
She's also anemic? Okay. But you said you're managing that fine?
Yeah.
Okay. All right. And then I'm going to ask you some more personal questions. Do you take any medications, including herbal supplements, anything over the counter?
Just that iron supplement.
Just
for
the
my,
iron? And again, you said no complications with that?
Yeah, no complications.
All right. Now I'm going to ask you some more personal questions. Can you tell me about your diet a little bit?
I eat a lot of fruits and vegetables, a lot of like whole foods and proteins.
Good. And you're getting in 3 meals a day?
Yeah.
Perfect. What about exercise? Are you getting any exercise in?
Yeah, I go for like daily 30-minute walks.
Okay. Do you get any pain with that? Any difficulty breathing?
No.
Okay. All right. These questions are going to be a little bit more personal. Again, there's no judgment here. This is a safe zone. Do you smoke at all, including marijuana, tobacco, vaping?
No.
Okay. Do you drink any alcohol?
No.
No. All right. And then this question is probably the most uncomfortable, but we do have to ask this to everyone. Do you experience any incontinence, which is just involuntary bedwetting, especially when coughing or sneezing?
No.
No? Okay. Well, I'm going to go ahead and get started with the assessment. Do you have any questions before we begin?
No.
All right. So I'm going to start with a set of vitals. Before I start anything, are you having any pain at all today?
No.
Okay. All right, well, I'm going to get started. I'm just going to start by getting your blood pressure. Do you have a preference of what arm I get it on?
This one.
You slide your arm right in there for me. That feel okay?
Yeah.
Does your blood pressure typically run low, high, normal?
It's normal.
Tighten that a little bit. That feels okay?
Yeah.
Okay. This is all tangled up. Okay. I'm using my diaphragm. Okay, you're just gonna feel a little squeeze. Might be uncomfortable for just a minute. First, I'm finding that brachial pulse. Okay. I got 124/62. Is that normal for you?
Yeah.
Okay. this off. Get this off here. Now I'm just gonna take your pulse and take it from your radial. You can just go ahead and relax for me. I'm gonna take this for a full minute.
Okay.
I got 66 for your pulse, and then I got 16 for your respirations, which are both normal. And I'm just gonna take a quick look at your fingers. Flip this over. So right now I'm just checking for signs of clubbing, which is just a sign of poor oxygenation over a long period of time. I'm not seeing any of that, so I would expect your SpO2 to be right around 97 to 100%. But I don't have a pulse ox here with me today. Your temperature also to the touch, it didn't feel too hot, it didn't feel too cold, and you didn't complain of any pain, so I would also anticipate that being normal, right around 98.6. So I'm just gonna start by looking at your hands. I'm gonna check your capillary refill. I'm just gonna feel a quick little push on your fingers. And that all came back under 2 seconds, so I'm not worried about poor perfusion. Just gonna inspect your hands a little bit more. Skin tone is even. I don't see any lesions or anything like that. I'm also gonna look at your arms. I do see some freckles. Do you see a dermatologist regularly?
Yeah.
And they don't have any concerns about that?
No.
Okay. So here I'm just feeling muscle tone and symmetry. They do feel symmetrical. Now I'm gonna check your pulse symmetry. So just like I did earlier, I'm just gonna feel your radial pulse again, but I'm just gonna make sure it's strong and symmetrical on both sides. Perfect. Those are strong and symmetrical. Now I'm gonna do the same thing, but with your brachial pulses. Perfect. And again, those are strong and symmetrical. Now I'm going to start with some range of motion exercises. While I'm at your shoulders, I'm going to check your cranial nerve number 11, which is your spinal accessory nerve. By testing that, I'm just going to put a little bit of force down on your shoulders, and I'm going to have you resist that by pushing up your shoulders against my hands. Okay? Just going to roll these back down for you. All right, and then whenever you're ready, perfect. So cranial nerve 11 is intact. Now I'm going to have you do some more range of motion exercises. I'm going to have you start with a swimmer's motion, just like this. And I'm going to have you do forward and backwards.
Okay.
You can start with this arm and backwards. Perfect. You don't feel any crepitus, which is just cracking in that shoulder joint. Now I'm going to do the same thing with your left arm. You can go ahead and go forward for me. Did you hear a little crack? Is that normal for you?
Yeah.
No pain with that?
No.
Okay. All right, and then I'm gonna have you move your hands in a circular motion. I'm just listening for cracking in those wrists. and other way. Very good, no cracking there. Now I'm going to feel for cracking in your elbow joint. So I'm going to have you do the motion of a bicep curl. And I'm just going to feel your elbows while you do that. Perfect. Again, no cracking there. Now I'm going to do a strength test. So I'm going to have you put your hands like this. I'm going to put my hands under these and I'm going to push your hands up and I want you to push my hands down, okay?
Okay.
Okay, and now opposite. I'll flip these up. I'm going to push your hands down. I want you to push my hands up, okay?
Okay.
Whenever you're ready. Good. I'll have you put your hands like this. I'm going to push your hands in. I want you to push my hands out, okay? Good. Then I'm going to put my hands on the inside of here. I'm going to push your hands out. I want you to push my hands in, okay?
Okay.
Good. All right. And then while I'm still up here, I'm going to test your cerebellar function. To do this, first, I'm going to have you make an okay sign. And I want you to touch each finger to your thumb. Good. And then I'm going to have you do that as fast as you can. Perfect. Now I'm going to have you lay your hands flat on your thighs and flip them. And then back. And then do that as fast as you can. Good. Cerebellar function looks good so far. And then just one last exercise for that. I'm going to have you touch your nose for me. And then I'm just going to have you touch the pen. Touch your nose for me. Pen, nose, pen, nose, pen, nose, pen, nose. Okay. Cerebellar function looks good. Don't have any concerns there. Now I'm going to finish range of motion on your legs. Just going to roll this up a little bit if that's okay. All right. First, I'm going to have you kick up your right leg for me. Good. And your left leg. Good. I heard no cracking there. While I'm here, I'm going to check your patellar reflex, which is in your knee. So I'm just going to have you close your eyes and relax for me. Feeling for your patellar tendon. I'm just going to give it a tiny little tap, okay?
Okay.
Good. Now I'm going to do your left side. Same thing. I'm just feeling for that patellar tendon. Good. Patellar reflex looks good. I'm going to head down to your feet. I'm going to have you circle your ankles just like I did with your wrists, like that. Perfect. Another way. I do hear some cracking in this ankle. Is that normal for you? No pain with that?
No.
Okay. And then I'm going to do a strength test with your feet, just like I did with your hands. I'm going to start by putting my hands right above your feet. I'm going to push your feet down. I want you to push my hands up, okay?
Okay.
Good. Now I'm going to push your feet up. I want you to push my hands down, okay? Good. I'm going to put my hands on the outside. I'm going to push your feet together. I want you to push my hands out, okay? Good. Now I'm going to push your feet out. I want you to push my hands together.
Okay.
All right, good. Everything looks good. All right, now I'm going to start with your head. Doing okay?
Yeah.
Okay. So first I'm just going to look through your scalp. Do you have a history of any infestations, dryness, itchiness,
No.
flakiness, oiliness?
No.
Okay. Do you get your hair dyed?
Yeah.
Do you get any irritation with that?
No.
Okay. I'm just going to take a look at the back of your neck. Skin tone looks even. I don't see any rashes or lesions or anything like that. Now I'm just going to feel for symmetry of your head.
Okay.
So you're just going to feel me kind of feeling around your head. Just let me know if you have any pain, okay?
Okay.
Any pain with that?
No.
Head feels symmetrical. While I'm back here, I'm just going to palpate your occipital lymph node. Feel any pain with that?
No.
Okay, that was non-palpable for me. Now I'm going to feel your post-auricular lymph nodes. Any pain?
No.
In your pre-auricular? Any pain?
No.
Are you in your submandibular? Any pain there?
No.
Your submental? Any pain? And then your cervical chain? Any pain here?
No.
Okay. I'm just going to loosen this up a little bit, if that's okay. I'm gonna loosen this a little bit.
Okay.
I'm gonna have you shrug your shoulders up and forward for me. And here I'm just checking for your supraclavicular lymph node. All right, that is non-palpable for me. While I'm here, I'm going to check your skin turgor. By doing that, you're just gonna feel a little pinch. Perfect. Let me just tie this back up for you. So there I was just checking for skin tenting, which is just a sign of dehydration, but I didn't see any of that, so I don't have any concerns there. All of your lymph nodes were non-palpable for me, and you said none of them hurt, correct?
Yeah, none of them hurt.
Since none of them were painful for you, I'm not concerned about any infections or malignancies. So now I'm going to move to your face. First, I'm just going to look at it. I'm looking for symmetry. Everything looks symmetrical. Do you experience any problems with acne, dryness, oiliness?
I get some acne.
Nothing too crazy?
No.
Okay. Now I'm going to palpate your sinuses. So let me know if you feel any pain.
Okay.
This is your maxillary. Any pain there?
No.
Okay. In your frontal? Any pain there?
No.
Okay. All right. That looks good. Now I'm going to check your ears. Do you have any problems hearing?
No.
Okay. First, I'm just going to take a look. I'm pulling the pinna up and back, and then I'm looking behind the ear. Everything looks good. Same with this one. I'm pulling the pinna up and back, and I'm looking behind the ear. Okay. I didn't see any excessive earwax or any obstructions. Your external canal looks good. Don't have any concerns there. No, I'm just going to feel your ears. Palpating your pinna. Any pain there?
No.
I do see you have some piercings. Did those heal okay?
Yeah.
Okay. All right. Ears look good. Now I'm going to start with your eyes. Before I start assessing your eyes, do you wear any contacts or glasses?
No.
Okay. Do you have any problems with your vision?
No.
Okay. Do you see an eye doctor regularly?
Yeah.
Okay. And they don't have any concerns?
Mm-mm.
Okay. If I had a Schnellen chart here with me today, I would check your cranial nerve number 2, which is your optic nerve. But since your eye doctor doesn't have any concerns, I feel confident assuming that cranial nerve is intact. Do you have any sensitivities to light before I begin?
No.
Okay. So first, I'm just going to assess your perla, which is your pupils. This also goes along with cranial nerve number 3, which is your ocular motor. So I'm just going to have you look at my nose, and I'm just going to shine this light into both of your eyes very quickly, okay? Perfect. Okay, your pupils were round, symmetrical, they're a good size, they were reactive to light. So your perla was good. Now I'm going to test your accommodation. So I'm just going to have you look at my pen, look at my hand for me, pen, hand, pen, hand. Good. Accommodation was good. Lastly, I'm going to test your cranial nerves 3, 4, and 6, which is your ocular motor, trochlear, and abducens. By doing this, I'm going to be doing the 6 cardinal fields of gaze, which is just a little snowflake pattern. I'm just going to have you follow the pen with your eyes and try not to move your head, okay?
Okay.
Good. Okay. So your cranial nerves 3, 4, and 6 are all intact. I do want to inspect your eyes as well. I'm just going to pull this up. I'm going to have you look down for me. Good. Then I'm going to pull this down, look up for me. Good. Eyelids look good. Sclera is nice and white. Conjunctiva is nice and pink and moist. So no concerns there. And then lastly, with your eyes, I'm just going to test your corneal reflection. By doing this, I'm just going to shine a light again, and I'm just checking for equal reflection in both of your eyes. You can just look at my nose again. Good. So I did see that equal reflection in both of your eyes. Now I'm going to move down to your nose. Do you have a history of any deviated septum, polyps?
No.
Any issues
No.
breathing or anything?
No.
Okay. First, I'm going to take a look. I'm going to have you lean your head back for me. I'm just going to take a peek in. Okay. Don't see a deviated septum. I don't see any polyps. Mucosa was pink and moist. Now I'm going to have you said you're not having any problems breathing today?
No.
Okay. I'm just going to have you plug one nostril with your finger and then take a deep breath in and out for me. Good. And then the other nostril. Good. Okay. Lastly, with your nose, I'm going to test your cranial nerve number 1, which is your olfactory nerve. By doing this, I'm just going to have you close your eyes and I'm going to have you smell something, and I just want you to tell me what you smell.
Okay.
Just to make it clear again, you don't have any allergies to food or anything?
No.
Okay. And do you have any sensitivities to any smells?
No.
Okay. You can just close your eyes for me. And then you can breathe in whenever you're ready.
Coffee.
Yep. Perfect. So your cranial nerve number 1 is intact. Now I'm going to move down to your mouth. Can you just show me your bottom lip? Perfect. And then flip up your top lip for me. Good. Teeth look good. Gums look good. Your mucosa is again pink and moist. I'm just going to take a peek inside. I'm going to have you open wide for me. Okay, mucosa's pink and moist. I don't see any cracked teeth or dental caries. Tongue is symmetrical. Everything looks good there. Okay, now I'm going to test your cranial nerves 9 and 10, which is your glossopharyngeal and your vagus nerve. By doing this, I'm testing your gag reflex. I'm not going to shove anything down your throat or anything. I'm just going to have you open nice and wide for me and stick out your tongue and then say ah. And I'm just going to be assessing your uvula.
Okay.
Right. And then whenever you're ready for me, just open up. I want your tongue out. And then say ah for me.
Ah.
Good. So your uvula rose as well as your soft palate. So that shows that your cranial nerves 9 and 10 are intact. Lastly, with your mouth, I'm going to have you stick out your tongue for me and then wiggle it back and forth. Okay. So that shows that your cranial nerve number 12, which is your hypoglossal nerve, is intact. You were able to move that tongue around. Now I'm going to test cranial nerve number 5, which is your trigeminal nerve. This has to do with your jaw as well as facial sensation. So first I'm just going to feel right here. I'm going to have you clench your jaw for me. Good. Unclench, clench, unclench. Good. Now I'm just going to test your facial sensation along with that cranial nerve number 5.
Okay.
I'm just going to touch this Q-tip to different spots on your face, and I just want you to tell me where you feel it.
Okay.
So I'll have you close your eyes for me.
Right cheek, nose, forehead, chin, left cheek.
Perfect. So your cranial nerve number 5 is intact. And then lastly, with your face, I'm just going to have you make some funny faces. I'm going to have you smile for me, frown, puff out your cheeks, raise your eyebrows. Good. So that's your cranial nerve number 7, which is your facial nerve. And everything on your head looked good. No concerns there. Now I'm going to assess your neck and your trachea. So I'm just going to look up for me and just feeling that trachea. Your trachea is nice and midline. Skin color is good. I don't see any cyanosis. I don't see you using your accessory muscles. Your respiration pattern is normal, so I don't have any concerns with trouble breathing. Now I'm going to assess your carotid arteries. First, I'm just going to feel for them. Okay, another side, and then I'm just lightly feeling for that carotid artery. Good. Now I'm going to listen for a bruit. which just is turbulent blood flow. This can be a result from narrowing of the arteries, and a whooshing sound would indicate a bruit.
Okay.
So I'm turning on my bell. I'm just gonna take a quick listen. I'm gonna find it. And then I'm gonna have you hold your breath for just 1 second. Okay. I heard no whooshing there. I'm gonna do the other side. I'm just gonna find it first. And then same thing, I'm gonna have you hold your breath for just 1 second.
Okay.
All right. I'm not concerned about any bruits in those carotid arteries. So now I'm gonna have you turn around if you are able in bed. Perfect. Feel okay?
Yep.
Any dizziness?
Nope.
Okay. Just a warning, I will be putting both my hands at the front of your neck. I'm just palpating for your thyroid. So I'm feeling your trachea, feel your Adam's apple. I'm coming to the side here. And then I'm just gonna shift your trachea to each side 1 time. And then when I do that, I'm gonna have you swallow, and I'll just let you know when, okay?
Okay.
Whenever you're ready. Okay, and other side. Good. So I didn't feel any enlargement of that thyroid. So now I'm going to assess your lung sounds. Is it okay if I untie this?
Yeah.
Okay. Is it okay if I untie this one as well?
Mhm.
So I'm just exposing the back. First I'm gonna inspect. I do see a freckle. I do see some little acne marks. It's completely normal. I do see a tattoo over here. Did that heal okay?
Yeah.
Okay. So I'm just noting that the spine is nice and central. And then I feel the scapulas here as well. Temperature is normal. Other than these little acne marks, skin tone is good. Don't see anything concerning here. Now I'm going to listen to your lung sounds. Each time that I place my stethoscope on your back, I just ask that you take a nice deep breath in and out for me. This can get tiring, so if you need a break at any time, just let me know.
Okay.
And I am using my diaphragm. All right. I'm just gonna move this down a little bit. I'm gonna move this up, okay?
Okay.
Good. Okay. Lung sounds were clear. I didn't hear any crackles or wheezing. Now I'm going to percuss, so you're just gonna feel a little tapping sound along those same 12 spots that I just listened to. If you feel any pain at all, just let me know.
Okay.
And I'm listening for resonance. Just gonna pull this down again. I'm just gonna pull this up again if that's okay.
Yeah.
So I heard resonance in all 12 spots, which is what we want to hear. Okay. So respiratory looks good, back looks good. Now we're going to do cardio, so I'm going to have you lay on your back for me. Feeling okay?
Yeah.
Okay. Just going to provide you privacy. This blanket. All right. First, I'm going to assess your jugular vein distension. So I'm just going to take this pillow away for just a minute. And have you look to your left for me. And then look to your right. Okay. I didn't see any of that jugular vein distension, which if I did, that would indicate fluid volume overload. And then I would reassess by moving the bed angle up to 45 degrees and then reassessing. But I didn't see any of that, so I'm not concerned. Now I'm just going to take a listen to your heart sounds. Is it okay if I expose your chest?
Yeah.
Okay. Goes up. All right. Feel okay like that?
Yep.
Okay. So first I'm noting that the skin tone is even, temperature is normal, everything looks symmetrical. I don't see anything concerning there. Okay. So here I'm going to be listening on 5 different spots with my belt and my diaphragm. Starting with my diaphragm. So here's your clavicle, clavicular space, rib 1, space 1, rib 2, space 2. So this is your aortic valve. Just listening for that lub-dub. Good. Just gonna hold my spot. And I'm turning on my bell. And here I'm just listening for any heart murmurs.
Okay.
Okay, I didn't hear anything, which was good. Now I'm going to move on over to your left side. I do have to press a little bit hard to feel your intercostal spaces. So again, if you feel any pain, just let me know.
Okay.
So moving over to your left side. Putting my diaphragm back on. Clavicle, clavicular space, rib 1, space 1, rib 2, space 2. So this is your pulmonic valve. Listening for that lub-dub with my diaphragm. Good. I'm going to turn on my bell for any murmurs. No murmurs. So I'm at space 2. I'm going to move down to rib 3 and space 3. I do have to go in your bra a little bit. Is that okay?
Yeah.
Okay. All right. And I'm at space 3, which is Erb's point. This isn't a valve, but this is the loudest point I'll be able to hear.
Okay.
So I'm going to go in with my diaphragm for that lub-dub. Good. Turn my bell on, listening for any murmurs. Okay. So here I'm at space 3. Is it okay if I go under your bra?
Yeah.
Okay, I'm holding my spot. So I'm at space 3. Going down to rib 4, space 4. Turning on my diaphragm. This is your tricuspid valve. Listening with my diaphragm for that lub-dub. Good. And then I'm turning on my bell for any murmurs. Don't hear any murmurs there. All right, so here I'm at space 4. I'm going down to rib 5, space 5, and then I'm going mid-clavicular right over here. I'm just going to recount that. Is that okay?
Yeah.
Clavicle, clavicular space, clavicle, clavicular space, rib 1, space 1, rib 2, space 2, rib 3, space 3, rib 4, go back under here, space 4, rib 5, space 5, and we're going mid-clavicular, just right here. And this is your mitral valve. Going in with my diaphragm. Good, I hear that lub dub. Going in with my bell. Okay, no murmurs there. Okay, I'm going back to my diaphragm. I'm going to listen to that apical pulse for a full minute.
Okay.
Gonna lift this up a little bit. Okay. I got 68, which is a normal pulse. I'm all done with your cardiac assessment. I'm just going to move this back up for you. And then is it okay if I expose your abdomen?
Yeah.
I'm just going to move this blanket down. Okay if I move this gown up?
Mm-hmm.
Expose your stomach. Provide any privacy. Is it okay if I roll this down a little bit? Okay. Alright. Doing okay?
Mm-hmm.
Alright. So before I start anything in the abdomen, I'm going to inspect. So I'm looking from the side of the bed. I don't see any masses or lumps or anything poking out. I do see your abdominal aorta pulsing out just a little bit above the belly button. But that's perfectly normal. Now I'm looking from the foot of the bed. Let me just flatten this out so I can see. Good. Again, I see no masses or lumps or anything. Everything looks symmetrical. Temperature is good. Do see a few little freckles. Does your dermatologist note those?
Yeah.
Okay. All right, so now I'm going to continue cardiac into your abdominal. So I'm just going to listen for bruits in your abdominal arteries. So first, I'm going to find your abdominal aorta, and I'm using my bell to listen for any bruits. So I'm just going to find your xiphoid process and your belly button, meet halfway. This is your abdominal aorta. Okay, you hear no whooshing, which would indicate a bruit. And I'm going down and diagonal. This is going to be your left renal artery I'm listening to. Okay, hear no whooshing there. To your right, this is going to be your right renal. Now I'm going to listen to your iliacs, which are just going to be straight down. I'm going to go just in your pants a little bit. Okay, hear no whooshing there. Heading down to your left iliac. Okay. So I heard no whooshing in any of those arteries, so I'm not worried about any bruise. Now I'm turning on my diaphragm, and now I'm going to assess your GI system. I'm just gonna listen again. This time I'm listening for gurgle sounds, which just indicates GI motility. So I'm hoping to hear at least 5 gurgle sounds in each quadrant.
Okay.
Okay, I heard 5 in the right lower quadrant. I heard 5 in the upper right quadrant. Heard 5 in the upper left quadrant. Alright, and I heard 5 in the lower left quadrant. So now I'm going to percuss again, just like I did earlier on your back. You're just going to feel a little tapping. If you feel any pain at all, just let me know.
Okay.
And here I'm listening for tympani. Good, I heard tympani in all 4 quadrants. Now I'm just going to percuss along your right side. So I'm going to start at your lower right quadrant and go all the way up to your ribs. Here I'm just listening for the change from tympani to dull, which is how I will know where the border of your liver is. So again, I'm just going to do that same tapping. Alright, so right along here I heard that dullness, which just indicates that your liver is right there, which is right where it should be. Lastly, of your GI system, I'm going to palpate. First, I'm going to start with light palpation. So I'm just gently going to feel around your tummy area. Just let me know if you have any pain. Just going to roll this down a little bit more. Okay. Just let me know if anything hurts, okay? Any pain there?
No.
Your upper right. Any pain?
No.
Upper left. Any pain there?
No.
Any pain?
No.
Alright. I'm going to start with deep palpation. So you're definitely going to feel this one a little bit more. So like I said, if you feel any pain with this one, just let me know.
Okay.
Any pain?
No.
Any pain?
No.
Any pain here?
No.
Okay. Any pain there?
No.
Alright. So your GI system looks good. I have no concerns there. Just gonna roll this back down for you. So now I'm going to assess your femoral arteries. This can be a little bit uncomfortable. I do have to go in your pants and under your underwear in order to feel and listen to that femoral artery. First, I'm just going to have you froggy your right leg for me. Perfect. I'm just going to head in diagonally. Just going to find that femoral artery first. Okay, and my fingers are right here. The other side, I'm just going to do the same thing. Froggy this leg for me. Okay, and my fingers are right here. Good. Now I'm going to check for symmetry just to make sure it's strong and symmetrical on both sides. I'm going to have you froggy both legs out for me. Good, and I'm going to feel both of them at the same time. Good, and those are both strong and symmetrical. My fingers are right here. Now I'm just going to take a listen to both of them. So again, I'm listening for those bruies. Turning my belt on. Just going to go in again and find it first. Good. My stethoscope is right here. I hear no whooshing there. I'm going to go on the left side. My stethoscope is right here. Good, and I hear no whooshing there. So I'm not worried about any bruises in your femoral arteries. It's down for you. Is it okay if I take your blanket off? Okay. So now I'm just going to assess your legs. So first I'm just looking. I do see a bruise and some little cuts. May I ask what those are from?
Not really sure. I was outside. I was in the garden.
Okay. And they're healing okay though?
It's probably just from that, yeah.
Okay. I'm just feeling for muscle tone and symmetry. Everything feels symmetrical here. Temperature feels good. Other than these few little cuts and bruises, I don't see any rashes or lesions or anything. Everything looks good there. Now I'm going to check for symmetry on your pulses. Is it okay if I take your socks off? Just going to put these in your shoes. I'm going to check for symmetry in your popliteal pulses. I'm going to have you bend your knees just a little bit for me. I'm hitting right at this crease of your bend, and I'm feeling for that popliteal pulse. Good. Those are strong and symmetrical. I'm going to do the same thing with your posterior tibialis pulse. So if you turn your feet inwards for me, and then I'm just going to feel right behind this ball of your ankle for that posterior tibialis pulse. Good, and those are strong and symmetrical. Now I'm heading up here to the dorsalis pedis pulse. Good, those are very strong and symmetrical. Okay, now I'm just going to inspect your feet. Just looking, especially at your heels. Don't see any redness. I don't see any breaking of the skin. Everything looks good. Temperature is good. Skin tone is good. They don't feel too hot or too cold. I'm just going to take a look in between your toes. Nothing concerning there. Now I'm going to check your capillary refill just like I did with your fingers. Okay, and your capillary refill all came back in 2 seconds, so I'm not concerned about poor perfusion to your feet. Don't see any signs of edema. Everything looks good. Now I'm going to assess your sharp and dull, which just tests for any loss of feeling in your legs or feet. Do you have any concerns with that?
No.
No? Okay. I'll pull this down a little bit more for you. To test that, I'm just going to have that same Q-tip I used on your face earlier, except this time it's going to have a sharp side. This is what dull's going to feel like. This is what sharp will feel like. Can you tell the difference?
Yeah.
Okay. So I'm just going to have you close your eyes, and then I'm going to do that along 8 different parts of your legs. Okay? So I'll just have you close your eyes for me and just tell me where you feel it and then if it's sharp or dull.
Okay. Sharp right eye. Sharp left eye. Sharp right knee. Sharp left knee. Dull right shin. Dull left shin. Dull left foot, or right foot, sorry. Dull left foot.
Okay. So you got 6 out of 8, but I'm not concerned about any loss of feeling or anything like that. Okay. So I'm going to have you sit up if you are comfortable.
Mm-hmm.
Do you feel any dizziness?
No.
Feel okay?
Yeah.
Okay. I'm just gonna put your shoes and socks on for ya. So now I'm going to test your cranial nerve number 8, which is your vestibulocochlear nerve, and this controls your hearing and equilibrium, which is your balance. Have you had any problems hearing throughout this assessment?
No.
Okay, I've noticed no problems conversating back and forth, so I don't have any concerns with your hearing. Now I'm going to assess your balance. By doing that, I'm going to be doing the Romberg test. So I'm just going to have you stand with me. I'll be right next to you in case you fall. And I'm just going to have you stand there, feet shoulder width apart. And then I'm going to have you close your eyes.
Okay.
And we'll just stand there for 10 seconds. Do you feel comfortable standing?
Yeah.
Okay. Let me just provide privacy first for you. I'm just going to tie this back up. No pain at all?
No.
And you said no dizziness?
Yeah.
Okay. Have you stand up and we're just going to do that Romberg test.
Okay.
And then I'll have you close your eyes for me. Feet are shoulder width apart. We're going to stand here for 10 seconds. All right. I noticed minimal swaying, which is a negative Romberg test. That's what we want. This is covered up for you. Do you feel comfortable walking with me? All right, we're gonna walk together to this door over here. You can just walk normally. I'm right here with you. Okay, I'll have you turn around. And then we're gonna walk back, head heel to toe. Again, I'm right here with you. All right, and then you can just take a seat for me. Do you have any questions?
No.
Okay, we are all done with the assessment. Everything looked good. I don't have any concerns. I am going to score you on the Braden scale, which is just something we use to score for a risk of pressure ulcers. I'm going to give you a 23 on the Braden scale, which is just the best score you can get. It's the least risk of getting a pressure ulcer. You said you have no incontinence, so I'm not worried about any excessive moisture. You said you're mobile, you're getting around and walking. I didn't notice any broken skin at your bony prominences or anything, so I don't feel concerned about any risks regarding pressure ulcers. So thank you.